I'd like to now turn our attention to our next session, Advancing the Decade of the Kidney Global Leadership in Patient-Centered Policy and Care. In June 2019, AAKP announced its major initiative, the Decade of the Kidney. This marks the time between 2020 and 2030 when kidney patients and their allies across the globe will accelerate greater innovations in disease prevention and treatment. Our goals have been very clear. We fully intend to transform status quo kidney care and its associated high mortality and high costs to patients and society. Our vision is to move forward towards a future that incorporates patient insights, ensures wider care choice, and produces targeted therapies that inhibit and cure kidney diseases. We believe closer collaborations among patients, researchers, and private industry will lead to therapies that prevent organ failure, increase the long-term outcomes of donated organs, and will bring about artificial kidneys. Some have asked where AAKP gained the confidence to declare that this, the decade of the kidney. That answer is easy. Our confidence comes from our legacy of working alongside public leaders whose understanding of people with chronic disease and personal courage to push policies that foster innovation has helped transform health and save lives. 50 years ago, the patient founders of AAKP embraced a similar ambitious goal. Their vision was to provide life-saving kidney dialysis care to every American in kidney failure. They wanted their fellow patients to be healthy enough to get kidney transplants and return to work in their communities. To achieve this mission, AAKP organized patients nationwide. They worked closely with allies in medicine, academia, and industry. And one of our brave founders dialyzed on the floor of the U.S. Congress, an act that led to the 1972 congressional passage of legislation for dialysis coverage. Our patient founders had also enlisted the aid of then-President Nixon's budget director, who strongly recommended the president sign the legislation in 1973. This is how modern dialysis in America was created. Our advocacy inspired patients around the world. That presidential budget director was later promoted to a position where he implemented the dialysis program. You may recognize the name Caspar Weinberger. Before he was President Reagan's defense secretary, he was the 10th secretary of the Department of Health and Human Services, or as it was known then, the Department of Health, Education, and Welfare. In 2018, the Honorable Alex Azar assumed office as the 24th Secretary of Health and Human Services. Secretary Azar shared a vision for transforming outdated kidney care that aligned seamlessly with the long-held interests of patients in the wider kidney stakeholder community. He brought his full expert knowledge of the pharmaceutical industry and past experiences as the Deputy Secretary of HHS to solve problems. Upon assuming office, he immediately brought kidney patients, including AAKP advocates, to his conference room to solicit their views and gather their insights, a practice he maintained throughout his tenure. In just a few short years, Secretary Azar cleared obstacles and launched initiatives that boldly challenged outdated thinking. He clearly led the way for patient-centered kidney medicine throughout new patient models that emphasize early intervention, timely treatments, and greater opportunities for kidney transplants. He promoted innovations, including artificial organs. In July 2019, almost exactly 4 years ago, the executive order on advancing American kidney health was issued. This historic document included the patient-centered policies championed and led by Secretary Azar. The executive order signaled a new chapter in American kidney health and inspired patients across the globe to unite and push for similar changes in their own countries. Before his term ended, kidney transplant patients were protected from the loss of transplant and drug coverage by the inclusion of lifetime coverage in the final 2020 budget agreement. This was a 20-year goal of the kidney community. It was accomplished under Secretary Azar. It is my great honor on this 5th anniversary of the Global Summit to celebrate the man behind the effort, our 24th Secretary of the U.S. Department of Health and Human Services, the Honorable Alex Azar, with AAKP's inaugural Global Kidney Leadership and Innovation Award. Before we welcome Secretary Azar, I'd like to ask Dr. Raj, as Summit Co-Chair, to say a word on behalf of the George Washington University School of Medicine and Health Sciences.
The 24th Secretary of the U.S. Department of Health and Human Services, Honorable Mr. Alex Azar, led the historic transformation of healthcare system in the United States and the HHS robust response to COVID pandemic. From the beginning, he made it very clear that he is not interested in preserving the status quo in kidney health, but embarked on a daunting mission to craft the Advancing American Kidney Health Initiative with the aspirational goal of better outcome through preventive care and person-centered treatment options. Even the critics acknowledge that the goals of the initiative are laudable and indicate a meaningful change for better health care. I just learned that Secretary Azar's father actually got kidney transplantation. I could see a personal and passionate touch in his commitment to the kidney community. So I, along with the kidney community, applaud our Honorable Health Secretary, Alex Azar.
Thank you, Dr. Raj. Secretary. So I'll take a moment. This award is presented for the courage to transform the global narrative of kidney disease and status quo care through principled policy, innovation, care choice, and patient-centered medicine. Secretary Azar, thank you very much. Congratulations, Secretary Azar. We'd be honored to have you share some remarks.
Well, thank you very much, Ed and Dr. Raj, for this deeply meaningful award. I'm greatly honored to receive the inaugural Global Kidney Leadership and Innovation Award in Kidney Medicine at the 5th Annual Global Summit on Kidney Disease Innovations. Ed, I'd like to thank you for your past service to America as a public servant on Capitol Hill, in 2 presidential administrations, and as a U.S. Marine. I've got tremendous respect for the work that you and AAKP are doing to aid military service members and veterans with kidney disease and their families through AAKP's close collaboration with the Department of Defense and the Department of Veterans Affairs. Dr. Raj, I know that both you and Dean Barbara Bass are deeply committed to applied research and patient-centered medicine and are making significant advancements in the field of kidney medicine and related illnesses here at George Washington University. I believe the vision that you and AAKP's former president, Paul Conway, bring as co-chairs of the Global Summit has been critical to raising international attention to the burdens of kidney disease and the need for greater patient care choice and preventive therapies and treatments. Equally important, this summit has brought a tremendous spotlight to the valiant efforts that medical professionals, researchers, and private sector industries are engaged in to bring new kidney care innovations to global customer markets. Over 840 million people suffer from kidney disease and kidney failure across the globe. Here in the US, over 37 million people suffer from kidney disease. Over 700,000 live with kidney failure, and nearly 100,000 people await a kidney transplant. Clearly, the need for regulatory and payment policies that encourage medical innovations has never been greater. When I was first notified of the decision to grant me this important recognition, I had several immediate reflections. The first was very personal. As Dr. Raj mentioned, for those who may not be aware, my father experienced kidney failure. And I was able to witness the entire continuum of kidney disease and kidney care in America, from diagnosis to center-based dialysis, to home peritoneal dialysis, to paired donor exchange transplant, to hospital dialysis, and eventually to death while on dialysis in the hospital. For the patients and caregivers listening and watching us today from across the globe, I want you to know that I truly understand the burdens that you manage and the journey that you are on. I think each of you has great courage and determination to face this disease and to continue the pursuit of your dreams and aspirations. Your disease does not define who you are, and it should never be used to either control or limit what you attempt to achieve as individuals. My second reflection was on the many discussions and meetings that I've conducted over the years within the kidney community. I thought of the many accomplishments the kidney community has achieved over the past several years, just as Ed Hickey recounted in his generous introduction. I consider myself fortunate to have contributed to these victories for kidney patients and kidney medicines. In my professional roles, I've met a wide variety of experts here in America and overseas in specialty medical fields related to kidney disease. They included nephrologists, transplant surgeons, cardiologists, endocrinologists, as well as nurses, techs, and social workers who spend most of their time caring directly for kidney patients. I've consulted with dozens of leaders from transplant centers, private and nonprofit dialysis providers, as well as entrepreneurs and executives leading research and innovation in fields of kidney diagnostics, devices, and drugs. And of course, as the Secretary of Health and Human Services, I led the many federal agencies responsible for researching kidney disease and treatments, paying for the complications of kidney disease, paying for and regulating the kidney transplantation system, and incentivizing and developing new kidney products and bringing them quickly to market and getting them reimbursed by Medicare and Medicaid. It is not an overstatement to say that I have had access to and continue to work closely with some of the most knowledgeable kidney disease experts in the world. Yet among all these experts, there is one group whose knowledge, sense of urgency, and clarity about the burdens of kidney disease rise above all others. Who are these experts? They are the patients I've had the privilege to meet and learn from directly. Among them were the patient advocacy leaders I welcomed around my conference table as my team and I led the development of the most significant changes to kidney care in the United States in 50 years. Their insights were indispensable to the creation of common sense solutions, including the 2019 Executive Order on Advancing American Kidney Health. I'm proud to say the patient leaders of AAKP were regular contributors to those discussions. Patients provided me with a broad and detailed picture of how the consequences of this deadly disease have been managed, or in many cases ignored, for decades. They were candid in their observations that far too many patients, especially people from historically underserved minority communities, were diagnosed with kidney disease in the emergency room amid medical crisis and failure, or as we say, crashing into dialysis. This, to me, was a tragedy with massive implications for people, families, and our national healthcare system. I listened closely as patients described how too few of their fellow patients were informed of their care choices of home dialysis or a kidney transplant. Instead, many patients were presumptively routed to in-center dialysis and were never informed how this could negatively impact their capacity to keep working and caring for their families and might instead force unplanned dependency on limited disability income. My father was a leading surgeon in the United States. Yet it took over a year for us to learn of the option of peritoneal dialysis that so improved his quality of life. Transplant patients, including AAKP's past president Richard Knight, told me stories of how the 36-month limit on federal transplant drug coverage was creating havoc for patients that experienced a subsequent job loss or insurance disruption. Before our 2020 establishment of lifetime immunosuppressive transplant drug coverage, a temporary job loss, or insurance disruption often forced transplant patients to choose between daily living expenses and the cost of continuing their transplant drugs. This meant some transplant patients needlessly lost their transplant kidneys and returned to dialysis, the transplant waiting list, or experienced premature death. And I listened to patients who had spent years on dialysis and the organ transplant list, asking why, in the face of high mortality rates, innovations like artificial wearable, implantable, or regenerative kidneys had yet to appear as a life-saving care option. So we drove forward the Kidney X program to incentivize innovation in kidney care. These patients understood that kidney disease was not simply a medical issue. They saw it as both an economic and workforce issue. For many, their lives were a testament to the fact that kidney disease denies people the opportunity to pursue part-time or full-time work, the ability to care for their families, and the chance to build a secure retirement. Patient insights, coupled with those of medical experts and other kidney stakeholders, fueled our efforts at HHS to change the narrative of kidney disease and to enact policy changes necessary to transcend status quo kidney care and begin a new era of patient-centered medicine. The result was a complete transformation in how we think about and pay for kidney disease management. Earlier disease detection, faster interventions, improved dialysis technologies, greater opportunities for organ transplantation and new transplant drugs, and artificial and regenerative organs are now the future of kidney medicine. These changes will result in the reduction of patient burdens, unacceptably high mortality rates, and unnecessary and wasteful spending associated with episodic and crisis kidney care. We're already seeing results from the change we made from fee-for-service reimbursement of center-based dialysis to value-based payments in Medicare that reward the type of patient-centered care we all desire. The electronic medical record company, Epic, reports that as a result of the advancing American Kidney Health Order, we are already seeing earlier diagnosis of kidney disease, which should enable prevention of disease and help reduce the rate at which patients crash into dialysis. We changed the payment structures to incentivize early detection, prevention, and treatment of chronic kidney disease. We incentivized home dialysis options. We incentivized transplantation, improved the rules for living donors, and we changed the rules to make organ procurement organizations more accountable and to improve their performance for patients. The best way to create sound policy and to improve kidney care here in the US and around the globe is to work directly with the stakeholders most impacted by disease. This means patients and not simply health systems or providers. It's vitally important for public officials, either appointed or elected, to listen closely to patients because government works for the people, not the other way around. The accomplishments we achieved would not have been possible without the consistent and robust support of patients and patient advocacy organizations. In 2019, AAKP launched the Decade of the Kidney and the Global Summit in order to expand international support among kidney patients and other stakeholders for increased kidney research and innovation. The lesson is clear. The organized voice of kidney patients can change status quo medicine and is key to advancing the next generation of kidney care treatments and cures. I strongly encourage industry to lean forward and work with patients as partners as new devices and therapies are developed. But because in the field of policy there are no permanent victories, only permanent battles, and because policies often change as national leaders and priorities change, kidney patients and their allies must remain fully engaged in the public and policy arenas. You must remain vigilant to preserve the changes in kidney policy and practice that we achieved, and you must hold your elected leaders and governments accountable if you believe they waver in their commitment to advancing the best interests of patients. Once again, I'd like to thank AAKP and the George Washington School of Medicine for this award and for inviting me to your 5th annual Global Summit on Kidney Disease Innovations. It's been a great honor to appear before you today. Your work is critical to the lives of patients across the globe. Thank you.